It's Dimple, the last day of the course. When you are willing to write the exam? Shobha is there?
Not true.
Shobha is not there. Okay. She is there. Shobha, are you willing to write the exam or not? Geeta Kumari.
Yes, sir, we can write, sir.
Okay. It's circulatory system. Write down the concepts what we are going to discuss. First one, pacemaker and defibrillator. Pacemaker and defibrillator. Pacemaker and defibrillator. Next one, central venous access device. Central venous access device. Central venous access device. Next one, CABG. Next one, vascular family. Vascular family. Next one, thrombectomy and embolectomy. Thrombectomy and embolectomy. Thrombectomy and embolectomy. Thrombectomy and embolectomy. Now first make heading CVAD. Central venous access device. CVAD. Central venous access device. Page number 302. 301 started from 300. Page number 300. Are you there, everyone?
Yes, sir.
Okay. Now write down the rules. CVAD procedures. First point, age of a patient. Age of a patient. Second one, centrally inserted or peripherally inserted. Okay, write down, strike it out. Write down like this. Catheter or device. Second point, catheter or device. Catheter or device. Third point, centrally or peripherally inserted. Central or peripheral inserted. Central or peripheral inserted. Next, tunneled or non-tunneled. Tunneled or non-tunneled. Tunneled or non-tunneled. Next, type of procedure performed. Type of procedure performed in that insertion, repair, partial replacement, complete replacement, removal. Insertion, repair, partial replacement, complete replacement, removal. Okay, what are the points we need to look for? First one is
Age of a patient,
patient. Next one is
catheter or device, centrally or peripherally inserted,
next one.
tunneled or non-tunneled,
Okay.
type of procedure performed.
How many procedures can be
These
performed?
are 5.
5. What are the?
Insertion, repair, partial replacement, complete replacement, removal.
Okay. Then radiological guidance.
Next point, sir.
Yes. Radiological guidance. Can everyone see the paragraph 3? See the code 36555. Above there is a paragraph. You can look into it. 36555. 36555. Above there is a paragraph. 36555. Above you can see a paragraph. Are we able to see that one? 365 above. When imaging guidance is used for centrally inserted central venous catheter, underline that paragraph. Make it as very, very important. There are 2 codes we can use for guidance. 76937. Just write down there ultrasound. 76937 is ultrasound. 77001 is fluoroscopic. 77001 is fluoroscopic. Next point. Write down. Device means, need to understand the terminology. Device means catheter attached to subcutaneous port or pump. Catheter attached to subcutaneous port or pump. Subcutaneous port or pump. Next point. Centrally inserted means the tip of the catheter in jugular vein, subclavian, femoral vein, jugular, subclavial, femoral vein, or inferior vena cava. Next one. Peripherally inserted means the tip of the catheter is in basilic, cephalic, and saphenous vein. Basilic, cephalic, and saphenous vein. Now, can everyone see the paragraph central venous access procedures? If you want, you can underline the first paragraph. To qualify a central venous access catheter or device, are you able to see that paragraph, everyone? Whatever you have written, you can see the rule here itself. To qualify as a central venous access catheter or device, the tip of the catheter or device must terminate in the subclavian, brachiocephalic, or innominate or iliac vein, superior or inferior vena cava, or the right atrium. The venous access device may either centrally inserted or peripherally inserted. If it is peripherally inserted, where it is terminated, basilic, cephalic, or saphenous vein. Understood? Now you can see in a whole. First, what we need to look for: age of a patient. Second point, catheter or device. Now you came to know the difference between catheter and a device. What is meant by device? When we call it as device?
Catheter attached to the subcutaneous port or pump.
When a catheter attached to subcutaneous port or pump, we call it as a device. Then next one, we need to look for whether centrally inserted or peripherally inserted. If the tip of the catheter is in basilic, cephalic, or saphenous vein, then peripheral. Then no need to remember all other names. Just remember these three names. Why? Because if you understand the peripheral, then the opposite one is central. If you would memorize these three names like basilic, cephalic, saphenous vein, if the tip of the catheter, it is a peripherally inserted. Other veins are nothing but centrally inserted. Next, you need to look for tunneled or non-tunneled. Now write down the definition of tunneled. Now I will show you the diagrammatic representation. Can you check this diagrammatic representation on my screen? Can you check this baby diagrammatic representation on my screen? Young child, can you see?
Yes, sir.
Can you see a catheter directly entering into the heart? They are placing directly into the heart through the vein. You can see here the next diagram below. They are passing the catheter underneath the skin to the jugular underneath the skin to the jugular vein. Can you see that one? Second diagram. Third diagram in that page. Write down. If a catheter is passed underneath the skin to appropriate vein it is known as tunneled. Non-tunneled, a catheter is directly placed into a vein without any movement. Directly placed into a vein without any movement. Without any movement. That is non-tunneled. Best example, for example, if you want to reach to your home, there are two ways you can prefer. One is, for example, in a better way to understand, you are using a helicopter directly landing on your home, that is non-tunneled. If you are moving through bike or cycle or bus on the road, moving and reaching to that location, that is tunneled. Directly at that site, non-tunneled. Moving and reaching to that site underneath the skin, that is tunneled. Just try memorize like this. Now you can check all those points. Can anyone explain now all those points? Central. What are the points we need to look for in CVAD? What are the points we need to look for in CVAD? Geeta, anyone?
Age of a patient.
Now is that clear everyone? Age we need to look for. Okay, next point.
Catheter of device, sir.
Now you came to know the difference between catheter and device, everyone. Any doubt in this point? Any doubt in this point? Okay, next one.
Centrally or peripherally inserted.
We know when we call it as centrally inserted or peripherally inserted. Everyone is clear regarding this point? Any doubt? Okay, next one.
Tunneled or non-tunneled.
Now everyone clear this point, tunnel, non-tunnel. Non-tunnel means directly placing at that site. Tunnel means reaching to that site by passing the catheter underneath the skin. That's it. The next one.
Type of procedure performed.
Type of procedure performed. How many possible procedures are there?
5.
What are they?
Insertion, repair, partial replacement, complete replacement, removal.
Okay, now you can see here, partial replacement, complete replacement means if you take device is composed of catheter and subcutaneous pump or port. Only catheter they are replacing, then it is a partial replacement, like that. Okay. Next one. Next one.
Radiological guidance.
Radiological guidance.
Good.
See question number 29 on my screen. Question number 29. Again I am saying, those who are willing to write the examination, practice the individual papers, what I am showing on diary at least 3 times. at least 3 times. Then you can easily clear your exam. Before writing the mock examinations, everyone need to practice at least minimum 2 times, maximum 3 times the same paper. Question number 29. See, PICC line means what? Peripherally inserted catheter. Okay. Now, what is the guidance they are using?
Fluoroscopy.
Fluoroscopy guidance.
Fluoroscopy.
They are asking to report for what services? Physician services. Yes, sir. Asking to report for physician services.
Three 6 5 7 1, sir.
3657.
1.
What is the age of a patient?
45 years.
45 years.
45 years. Now, go with the code description 36568. What is the description 36568?
Insertion of peripherally inserted central venous catheter without subcutaneous port or pump without imaging guidance, younger than 5 years of age.
Younger than 5 years of age means what? Less than 5 years. Yes or no? Here, what is the age of the patient? 45. Okay, blindly ruled out 568. Then come to 570.
570 also 5 years younger than, sir.
Younger than 5 years of age. Yes or no? That also we can blindly rule out. Next, what is the next one? 571. 36571.
Old. 5 years older.
Age 5 years or older. Then what is the answer?
36571. That's the answer. 26.
Okay. Now they are asking to report for physician services. What is the modifier we need to use?
26.
26 modifier. Then what will be your answer?
B.
B for Bombay. Understood, everyone?
Yes, sir.
See, this, whatever you have coded, everything is in that points itself. Age, catheter or device, next centrally or peripherally, tunneled, non-tunneled, radiological guidance, everything you are getting from the same points. You need to memorize those points to do this type of questions. Okay, is that clear, everyone? Is that clear, everyone? Okay, now you can see there is one table for you. All the table is summarized at one location. Are you able to see this table on my screen? Page number 304. It may be dark in your book. Can you see here on my screen, everyone? Yes, sir. No?
Yes,
Okay.
sir.
Now you can see the rows. What they have written is non-tunneled, tunneled, centrally tunneled, tunneled with port, tunneled with pump, peripheral, less than 5 years, greater than or equal to 5 years, any age. Yes or no? Now first, what is inserted? For example, catheter. With or without imaging guidance, you can say without. Now, without, you can see peripheral, under peripheral 36568, 569, 572. Sorry, 568, 569. 568, 569, two codes. Less than 5 years, 568. Greater than or equal to 5 years, 569. Are we able to see that one? The table. If it is centrally inserted, two codes. What are the two codes? 36557, 558. If catheter without guidance. If it is non-tunneled, 36555, 36556. Understood now, everyone? See, this table also useful for you to rule out the options very fastly. For example, if they are placing device, again you can see these columns. If it is peripherally inserted, see directly peripherally. If it is centrally inserted, directly see centrally inserted. What are the codes? Then you need to look for the other subdivisions with port or with pump. Understood everyone this table how to see? Yes sir. No? If repair is done directly, what they have repaired, catheter or device, you can see directly the codes. Partial replacement, by default only one code. Complete replacement, then catheter with guidance, without guidance, or device. Removal of obstructed material means any clots. See, when you are definitely you will get a question from CVAD 100%. Why? Because this is the common outpatient procedure done by the physicians. Definitely just go through the rules and come and see the table. Okay. Next, make heading CABC. CABC. Have a look for 2 minutes that concept. Any questions you can ask me. Why? Because definitely you will get a question in the exam. Before going to CABC, any questions you are having from CVAD? Any questions you are having from CVAD? Anyone in the class? Any questions, anyone? Is that clear, everyone, that concept? CVAD, is that clear, everyone, the concept?
One in this table, this less than 5 years and more than 5 years, this last three columns, they are for peripheral or what?
For all the, for example, if you take a device, okay, device centrally tunneled, you can see there are two codes. What are the two codes? 36560, 561 on my screen. Tunneled with port 560, 561, the same codes. But how these codes are divided based on age? If age is less than 5 years, 560, greater than 5 years, 561. If you take the code 36565, 36563, no need to check the age, any age. It may be 5 years or 10 years, like that. Understood now?
Okay.
Okay. The simplest way is you can see the age in the code description question first. Directly come to the codes under the age column. Check under less than 5 years that code is there, or greater than 5 years that code is there, or any age. Like that also it is one of the easiest way to rule out the options. Okay.
Okay.
Any questions still in that CVAD? Anyone? Geeta Kumari, Shobha, Susmita, Pravalika, Vishnu, Sunil. Any doubts in that concept? No one is replying.
Till now, not now, sir. After practicing the question, we will get more doubts, I think.
Okay. So next concept then. CAVC. CAVC. CAVC means coronary artery bypass grafting. Alright done. Codes are based on first point, number of arteries used. Next point, number of veins used. Next point, arteries and veins. Third point, combination of artery and vein used. What are the three parameters we need to look for when we are getting CAVC procedure? What are the three parameters we need to look for when we are getting CAVC procedure? What is the first point?
Number of arteries used. Next one. Number of veins used. Number of veins used.
Okay, next one.
The combination of arteries and veins are used.
Yes or no? See, these are the three parameters first we need to look for CAVC procedure. The codes you can see. Go with the code 33533. Page number 256. Page number 257. Page number 257. Page number 257. Are you there, everyone? Page number 257.
Yes, sir.
You can see the scenario. You can see my screen. Okay. So you can say this is a coronary artery. If there is a coronary artery, CABG means what? Coronary artery bypass grafting. Where you are performing this bypass grafting on coronary arteries. Yes or no? Now if this coronary artery get obstructed, you can see like this. A plaque is there. Now this is the scenario. Now the blood will flow easily through the coronary artery. If it get obstructed,
No.
no. Now physician have to do, they have to remove that plaque material. We call it as atherectomy. Have you gone through that PTCA procedures, percutaneous transterminal coronary angioplasty? They will place a stent. That is one possibility. If that is not possible for that patient, then what they will do? From his own body, they may take a vein, they may take an artery, or they may take both as a graft. Graft means what? Harvesting from one location, or procurement, or taking from one location and placing in another location. Now I am taking vein as a graft. Now what I am doing? I am just, you can see this is the scenario. Here it is obstructed. Now what I am doing? I am just altering the route like this. I am just altering the route. Now the blood is entering like this. Understood, everyone? See, just I altered the route. If you want. The blood clot is here. Now you can see this diagram, you will understand. What I am doing, the blood previously flows in this direction. Now I am using as a graft and I am altering the route of the blood flow. This is nothing but CABG. For that, how many veins used, how many arteries used, or a combination of arteries and veins, how many they used. Now if you see the code descriptions 331510, 33510. Can you see the code description 33510? How many veins used for that procedure?
One.
512, 512, 3. Like that you need to count just the number. Now here one point is from where that vein is harvested. For that you can underline the paragraph. Can you see under venous grafting, procurement of saphenous vein? That paragraph, are you able to see? Under venous grafting under that second paragraph, procurement, this one. Are we able to see this paragraph, everyone? In the same page number 257. Yes or no?
Yes, sir.
Yes, sir.
Yes, sir.
Try to underline that paragraph. If the vein they harvested is saphenous vein, it is included in the procedure. If the vein harvested is upper extremity vein, upper extremity means arms, we need to code for harvesting of vein separately. What is the code? 35500. If the vein harvested is femoropopliteal vein, these are the three possibilities only they will take. The code is 35572. Understood, everyone? See, there are three veins they can use for CABG procedure. What are the veins? Saphenous vein. Next one is femoropopliteal vein. Next one is
Upper
Upper
extremity.
extremity vein.
What are the two veins we need to code separately?
Upper extremity
vein and femoropopliteal vein. Understood? Underline that rule. Next one. You can see the code 33508 add-on code. Add-on code. If harvesting, that means when you are taking that vein, you are using any endoscopy, then you need to code 33508 separately. You just mark that code 33508 add-on code. Are you able to see that one? 33508 code. 33508. It's an add-on code. Yes, sir. Yes, sir. No. Are you at that code or not?
Yes, sir.
Yes, sir.
Now, if this is all about vein, for example, if physician used artery, only artery for CABG procedure, then see the codes 33533, page number 259. If you want, write down the code series. Only for arteries. What is the code series? 335332536. Can you look into that codes 335332536? Single artery, single vein, single artery, two arteries, three arteries. Is that clear?
Yes, sir.
Okay. Now again here, what are the arteries that can be harvested? Arterial grafting for coronary artery bypass. That you can see the first paragraph, page number 259. Arterial grafting for coronary artery bypass is there. Underline that first paragraph. Underline that first paragraph. What are the arteries they can use? Internal memory artery, gastroepiploic artery, epigastric artery, radial artery, arterial conduit from other sides. These they can be harvested. From this, only one artery we need to code separately, that is radial artery. Just write down there itself in the book. Radial artery can be coded separately. What is the code? 35600. Radial artery. Only radial artery can be excluded, can be coded separately. All other are included in the procedure. What is the code for radial artery? 35600. Understood everyone? Is that clear everyone? See, for veins, what are the veins they're going to harvest? For arteries, from which to harvest, which one we need to quote separately? Now, the third point, if they use a combination, that means one artery and vein for CABG procedure. Now you can see arteries we need to use from the same code series, but always keep in mind when they are using combination for veins, you can see 33517 add-on code. 33517 add-on code, page number 258. 258 add-on codes. Can you see that add-on codes everyone? 33517 518.
Yes, sir.
Okay.
Yes, sir.
Make a note and write down. If a combination of artery and vein is used for CABG procedure, if a combination of artery and vein is used for CABG procedure, for veins, always use from add-on codes 33517. For veins, use always from add-on codes 33517 to 33523. 517 to 33523. 517 to 523. Now, take one question and give me the answer. First question. For CABG, 3 arterial grafts are used. Give me the code. For CABG, 3 arterial grafts are used. For CABG, 3 arterial grafts are used.
33519.
Again, listen the scenario. For CABG,
33535.
3 arterial. What grafts?
33535.
Arterial grafts are
Okay.
used. What is the code? 33?
Okay.
535.
33535.
Okay.
33535.
Next one. Next question. For CABG, 3 vein grafts are used. For CABG, 3 vein grafts are used.
3351.
33519.
33?
512.
512.
512.
512.
Okay, now understand
Sampath.
everyone. See, for individually arteries, there is a primary code series. For only veins they performed, we are using from primary series. Next, for example, for CABG, 2 arteries and 2 veins are used. This is the question. For CABG, 2 arteries and 2 veins are used. Now try to text your answers. 2 arteries and 2 veins are used for CABG. For CABG, 2 arteries and 2 veins are used. Two arteries and 2 veins. Sunil, can you give me your quotes? Sunil.
Checking, sir.
Okay. See, for arteries, what is the code series you are using, Sunil?
Sir?
For arteries, what is the code series we will use? From code for arteries.
33533.
33?
33533 series.
Okay. How many arteries used for the procedure?
2.
What is the code for 2?
33534.
33534. Okay. Now, they used both as a combination, 2 arteries and 2 veins. Yes or no?
Yes, sir.
For veins, if they used combination, then I said a rule for you. Can see the rule from where you need to code.
518.
Now, what are the answers for that codes? 33534, 33518.
518.
Understood now?
Yeah, sir.
Geeta, why you coded 33517 and 33 something you coded, Geeta? 511 and 518. Why? Why you coded 33511? See, they used arteries and veins, not veins, vein graft. That add-on codes used only along with arterial grafts. You can see the parenthetical note, Geeta Kumari. You can see parenthetical note when you are going to code basics. Can you see below the code 33518? What is that add-on code says? Use 33518 in conjunction with only 335332536, not with 312313. Understood? Take one more question.
Okay.
Take one more question. 3 arterial and 3 venous grafts. 3 arterial and 3 venous grafts are used for CABG. 3 arterial and 3 venous grafts are used for CABG. Three arterial and 3 venous grafts are used for CABG. Geeta, you need to tell me the answer. Geeta, what are your codes? How many arterial grafts used?
3, sir.
3. Now check the codes 3 where you are getting.
33535.
535. Now they are using a combination artery and vein. For vein, what is the code series we need to use? For vein.
517 33523.
Now how many veins they used?
3, sir.
3. What is the code?
519. 33519.
33519. Understood now, everyone? Is that clear how to code CABC? Is that clear, everyone, how to code CABC?
Yes, sir.
Okay. Now try to practice one question. Question number 11. 1. Question number 11. Text me your answers so that I came to know who understood the concept. Question number 11. Question number 11. Vishnu, can you explain this question?
Yes, sir. In this, 1 venous and 3 arterial grafts are used.
Okay, 1 venous and 3 arterial. For 3 arterial, what is the cost?
For 3 arterial, it is 33535.
535. Okay, where it is in the option A and D. Yes, sir.
Yes, sir. Yeah, indeed.
Now, how many veins
And
they
for venous,
okay.
For venous, it is 33517. Add-on code.
Then what is your answer?
Option D.
Okay, if you see, some people will go blindly as A. Okay, no two primary codes can never be coded together in CABC. Artery and vein, we will never use primary codes. For veins, always we need to code from add-on code. Understood, everyone? And make a note there. 51 modifier will never be reported along with add-on code. Make that note anywhere, somewhere, everyone. Do not report 51 modifier with add-on codes. Do not report 51 modifier with add-on codes. Do not report 51 modifier with add-on codes. Okay. Everyone answer is D. Any questions in CABC? Is that clear, the concept? Is that clear, everyone, the concept? Any questions? See here, what are the arteries they coded? Radial artery they coded. Radial artery only they coded. Remaining saphenous vein is a part of the procedure. Then internal memory is a part of the procedure. Okay. Understood, everyone, this concept? Any doubts in question number 11? Any doubts in question number 11? No doubts? Okay. Next concept, make heading. Pacemaker and defibrillator. Next concept, pacemaker and defibrillator. pacemaker and defibrillator. Pacemaker and
Mohan,
yes.
angioplasty is remaining, no?
That completed already PTCA in medicine.
Okay. I joined it, please.
Yes or no? Anyone? Could you please recall? Did I completed angioplasty procedure for you or PTCA?
Yes, completed.
Okay. Yeah, no, check with the medicine section videos. Okay, I completed.
Sir, can you explain the 11th question detailedly for the options? Because I got clarity on first two, and the last one I didn't get. Last two I need more information, sir.
Means what are the codes?
About 33530, 33530 and 35600.
See, for CABG procedure, I have shown you to mark some paragraph. Harvesting of artery and vein. Yes, sir. No? If you go with upper arteries, radial artery, we need to code it separately or not? That point I said.
Yes, sir.
Okay, what is the code for radial artery?
35600.
33530.
Radial artery.
35600.
35600.
That's why they coded that separately. Why? Because it is not a part of the procedure. Why they didn't code saphenous vein and internal memory artery? Those are included in CABG procedure harvesting method. Then what is the code description 33530? Read the code description 33530.
Okay, they used means they harvested the arteries and veins separately.
You can see this is.
Yeah, now I got sir.
Okay. See, if they want to bypass, they need to take from some location. Okay, that location, code or not, depends upon the guideline. Upper extremity artery we can code, whereas memory artery, saphenous vein, it's a part. If you harvest it from that location also, it is a part of the procedure, like that. Okay. Next.
But here mention more than 1 month. Here mention that is also considered, sir.
Yes.
33530.
That's why they have given the code. Read the code description 33530. 33530.
Pre-operation coronary artery bypass procedure.
Volume procedure.
More than 1 month after vaginal operation.
That's why they coded that. They used that code 33530. Understood now?
Yes, sir.
Yeah. Next one, pacemaker and defibrillator. Pacemaker and defibrillator. Pacemaker and defibrillator. Now, write down the rules. First, see, listen. Why pacemaker and defibrillator will be used? As we know, during anatomy, we discussed about conduction system, like natural pacemaker. Natural pacemaker. Have you heard that natural pacemaker? Can anyone in the class give the name of natural pacemaker in a human body?
SCA node, sir.
Say node. Sinoatrial. Natural pacemaker. Now what the physicians will do is, for example, that natural pacemaker is not generating electrical impulses, then there will be slow heartbeat, or if it is generating fastly, then is fast heartbeat. Bradycardia, tachycardia. What is the condition? Bradycardia, tachycardia. Brady means what? Slow heartbeat. Tachy means what? Fast heartbeat. Then to manage that scenario, what the physicians will give, they will place artificial pacemakers or artificial machine, that is nothing but defibrillator. If the heart rate is very slow, they will use pacemaker. What is the artificial machine? Pacemaker. If the heartbeat is too fast, are too slow, then they will use, for both the purposes, they will use defibrillator. Understood now? Why they will place pacemaker and defibrillator? Because of malfunction in which body part in human body? Abnormality in which body part in human body? Abnormality.
I think
Sinoatrial node. What is the node? Sinoatrial node. That is the natural pacemaker. The abnormality in that node. To treat that abnormality, what the physicians will use? They will use artificial machines. What are the machines? Pacemaker and defibrillator. Right on. Reason for the procedure is bradycardia and tachycardia. Reason for the procedure is brady and tachycardia. Brady and tachycardia. Next, we need to use type of machine. Type of machine. What we need to look for? Type of machine. In bracket, pacemaker or defibrillator. Pacemaker or defibrillator. Type of machine, pacemaker or defibrillator. Second point, you people can tell me how many chambers are there in heart?
4 chambers.
4 chambers are there. Now, if you see the conduction system, SA node, from SA node to AV node to bundle of Purkinje fibers, like this the concept is there. In place of that one, the physician will place lead. Write down. Number of leads placed. Second point, after finding the type of machine, second point, number of leads placed. Third point, approach. Approach of the lead. Approach of the lead. That means how that lead is placed. Approach of the lead. Transvenous or epicardial. Transvenous or epicardial. How many ways they can place the leads into the body? Through transvenous or epicardial. Next point. Number of chambers. Number of chambers. Number of chambers. Now, tell me what are the points we need to look for when we are going to quote pacemaker or defibrillator? What are the points we need to look for when we are going to quote pacemaker or defibrillator? What is the
Type of machine.
Type of machine. That means how many types of machines they can use?
2. Pacemaker or defibrillator.
Pacemaker or defibrillator. That is the first point. Second point.
Number of leads placed.
Number of leads placed. That means how they can place the leads. How they can place the leads.
Transvenous or epicardial.
Transvenous or epicardial. How many leads they can place? Single, 2, 3, like that. Understood? The basic points what we need to look for. Now go for the code series in your book. 33206. 33206. Directly go with the page number. 242.
245.
242. 242. 242. Page number 242. 242. Now you can see a table there, page number 244. 244 table, you can see table there.
Yes, sir.
Now listen, this table is used for transvenous placement of leads. Just write down what is the placement of lead. Transvenous placement of lead. Transvenous placement of lead. Now this is the best table to identify the question easily. There are two approaches of leads. One is transvenous, another one, what is I said? What is I said? Epicardial. Only two codes are there in CPT book for epicardial. 33202-203. You can mark it as epicardial and follow the parenthetical notes. 332-203 is for epicardial placement. 202 and 203 is for epicardial placement. Understood now what are the codes used for transvenous and epicardial placement? Now you can see here, come to the table, how many possible procedures they can perform. Now you can see, first, they can place a lead. You can see the first column, single lead. They can place dual leads, that means 2 leads. They can place multiple leads, means more than 2. Understood? Those are the first 3 columns. If the pacemaker is there, 216. Defibrillator is also 216 for placement of leads. Understood? If you see the 4th column, they are placing the pulse generator, only pulse generator to the existing lead. That means what? Already lead is there in the body. To the lead, what they are placing? Pacemaker. If it is 212, if it is defibrillator, what is the code? 240. Understood by reading the code description in the table. If you see the 5th column, 5th row, dual leads are there in the body. They are placing pulse generator. Dual leads, they are placing pulse generator. What is the code series? 221, 231. Understood? Next point you can see multiple leads. Now write down the points everyone. Types of procedures performed. Types of procedures performed. Types of procedures performed. First one, insertion of lead. Insertion of lead. Second one, placement of generator to existing lead. Placement of generator to existing lead. Third one, placement of generator and lead together. Placement of generator and lead together. Next one, replacement of lead and generator together. Replacement of lead and generator together. Replacement of lead and generator together. Next, upgrade from 1 lead to 2 leads. Upgrade. Upgrade. Next, removal of generator. Removal of generator. Next, replacement of only pulse generator. Replacement of only pulse generator. These are the possible procedures. Now you can tell me. You can say one more and last point. Removal of leads. Removal of lead. Removal of lead. Now you can tell me one by one point. What is the first point I said? What is the first point?
Insertion of lead.
Insertion of lead. That means first 3 columns. First 3 rows you can see. That is the insertion of lead. First 3 rows in the table. Second point. Second point.
Placement of generator through existing lead.
You can see the 4th row, 5th row and 6th row. 4th row, 5th row and 6th row. Next point. Next point.
Placement of generator and lead together.
7th row, 8th row and 9th row. 7, 8 and 9. Next one.
Replacement of generator and lead together.
Same code series. 7th row, 8th row, 9th row. We can use the code for placement or replacement. 7th row, 8th row, 9th row. Next.
Upgrade of one lead to another lead. 2 leads.
You can see after that upgrade is the key term. Upgrade single chamber system to dual chamber system. That means 1 lead, 2 leads if you placed in 2 chambers, that is upgrade. Next.
Removal of generator.
Removal of pulse generator only. You can see the code 33227 in the row. That is the concept. Next.
Replacement of only pulse generator.
See. Removal of generator, the code is 33233. The next 3 codes are used for replacement of pulse generator. Next.
Removal of lead.
Last rows. Removal of lead. Now these are the possible procedures performed using machines. Now you can tell me, what is the first point we need to look for when we are getting this type of question? What is the first point we need to look for? What is the first point we need to look for?
Type of machine.
Type of machine. How many types of machines are there?
Two types.
Are they? Pacemaker,
defibrillator.
Next point.
Number of leads are placed.
Number of leads are placed. That means single chamber, dual chamber, multiple. Next. How the leads are placed. Transvenous, epicardial. I have shown you the codes. What are the codes used for transvenous? What are codes used for epicardial? Next.
Number of chambers.
Number of chambers. Next. Types of procedures performed. Yes, sir. Now try to see the question.
When we use pacemaker and defibrillator, sir?
Sorry?
What is the condition this when we use this pacemaker and defibrillator?
Heartbeat,
what is the condition?
Bradycardia, tachycardia. That's what I said initially. If the heartbeat is slow, to increase the pace of the heart, they will place pacemakers. If the heartbeat is too fast or too slow, both the conditions are there, then they may use defibrillator.
Okay.
See question number 17. 17. Try to see in the table where is that point. You can code it. Follow the table. What is the question number 17 says?
Replace a single chamber permanent pacemaker with dual chamber.
Dual chamber permanent pacemaker. Read the code description so you will get it. 33213. Slowly you can analyze the table. So if you see the table, you will get that point. I'm giving a hint for you. Understood what I'm saying, everyone? Try to see the table, you will get the point.
Mohan, I think it consumes more time to see that table instead, we can quickly refer to these codes.
This is upgrade, I think.
Oh.
3332127.
33?
33274.
27.
Place length, but it's not upgrade.
Okay.
33214.
33214 is the correct answer. Padmavati, what is
Upgrade.
33214?
33214.
33274 it is.
I'm going with the table, sir. Replacement of permanent legless pacemaker. I'm thinking some add-on code may have some series.
Where it is in that 3327?
In the tabular list, sir. I'm going with just tabular list.
But
Insertion, replacement
see,
of before.
in options there is no 33274. From where you have coded 33274 then? We need to see look up.
Exit.
First we need to look into the options. Where is that option? No option. See, 33214 is the correct answer. Everyone? 33213 is nothing. Removal of leads. They are not doing here. They are converting from single chamber to dual chamber. Upgrade that they are doing. By reading the code descriptions, you can rule out that options easily. 214 is the correct answer. Next, see the question 22. 22. Question number 22.
Double 3202, sir.
See, first point. What is here machine? Name of the machine. Follow the rules what I said. You will get 50% of the answer clearly. What is the name of the machine here?
Machine.
Pacemaker.
Pacemaker, sir.
Pacemaker. 1 point. Second point. How many chambers are involved here? How many chambers?
2 chambers.
2 chambers. Okay. Third point. What is the placement of lead? Transvenous or epicardial?
Epicardial.
Epicardial. Now almost based on the points you will get 50% of the answer. As I said, there are only 2 codes used for placement of leads. 3320. 203. Now here what they are performing? Medial
Open
sternotomy,
incision.
202. Where is 202? It is in the option
C.
C. Understood? And you can see, can we use 33213 along with that one? Yes, if you see parenthetical note under 33203, when epicardial lead placement is performed with insertion of the generator, report 202, 203 in conjunction with 212, 213, 221. Clearly, a rule is there or not there? Everyone, try to see the rule under 33203 code description. Mark that rule. Everyone, is that clear now? First, identify the machine, then identify how many chambers, then identify how the leads are placed. You will get maximum answer. Is that clear, everyone, this question? Any doubts? Any doubts in this question? No one? See, tell me whether you are having doubts or not, so that I will go for the other concept.
No, sir.
You understood this concept?
Yes, sir.
Shobha, Geeta Kumar,
Yes, sir.
Susmita,
Yes, sir.
Dimple, have you coded the question?
C, sir.
C coded. Okay.
Yes, sir. 33202.
Okay. Next, make heading thrombectomy and embolectomy. Thrombectomy and embolectomy. Thrombectomy and embolectomy. Mark the code in your textbook 35301. 35301. 35301, that is the important procedure doing in the inpatient visits. Common procedures. Thromboendarterectomy for carotid arteries. 35301. It's a direct code. 35301. 35301. Somewhere you can write down. Thromboendarterectomy, carotid artery. 35301. Are you there, everyone? 35301. Code description.
Yes, sir.
Come to page number 243. Sorry, I will tell you the codes.
285.
34001. 34001. 34001. Are you there? 34001.
Yes, sir.
What is the page number?
274.
274.
270. You can see that thrombectomy, embolectomy is there. Code descriptions. Can anyone in the class, can you define, if any coder is there, thrombus, embolism, thrombus? What is the difference between these two?
Movable blood clot is called embolus, sir.
Yeah, write down. Movable blood clot is embolism. Movable blood clot is embolism. Thrombus means blood clot at a particular location, not movable. Blood clot at a particular location. There are no rules here, just you need to look for the incision and artery or vein. Okay, mark the codes in your book. You can look for first, what is the look for? Type of incision. These codes, type of incision. Next one is artery or vein. Artery or vein. What is the code series? 340012 34490. 340012 34490. These code series. What are the 2 points we need to look for? Artery or vein. Second point is type of incision. Type of incision. Now go with the codes, everyone. 36216. 36216. 36216. Are you there, everyone? 215, 216, 217, 218. Mark, write down the codes in your book. Vascular families. In that first family, 36215, 216, 217, 218. That is one series. What is the code series for one family? 215, 216, 217, 218. For the second family code series, you can note down 36245, 246, 247, 248. 36245, 246, 247, 248. Now try to read everyone the code description before going to learn vascular families. Everyone go with the codes. Go with the codes. 36215, 36215. Are you there, everyone? 36215.
Yes, sir.
Okay, try to read the code description. Read the code description. Anyone in the class? 36215.
Selective catheter placement.
Okay.
Arterial system, each first order thoracic or brachiocephalic branch within a vascular family.
Thoracic or brachiocephalic. Brachiocephalic means innominate. Write down there. Innominate. Brachiocephalic means innominate. Yes, sir. Next one. 36215 arterial system. First order. 36216. Read the code 36216.
Selective catheter system.
Okay.
Arterial system. Initial second order thoracic or brachiocephalic branch within vascular.
Okay. Now 36217. 36217.
Selective catheter placement arterial system.
Okay.
In initial third order.
Okay.
Or more selective thoracic or brachiocephalic branch within vascular family.
Third order. That means if you go in a simple way, 36215 is for first order, 36216 is for second order, 36217 is for third order. Beyond the third order, what is the code? 36218. Beyond the third order,
that is add-on code.
Second order or third order, that is add-on code. Now come to page number vascular families 917, 917 in your books. CBT book 917, 917. Are you there, everyone?
Yes, sir.
Okay. You can see the codes here, but it will little bit be very dark for you. I hope so. Are you able to see these families there?
Yes, sir, it is clear.
Clear? Okay. Now you can see here.
Yeah.
Can you see the abbreviations first of all on my screen? R for right, L for left,
Yeah.
ANT
Left.
for anterior, posterior, POST for posterior, SUP for superior,
Superior.
INF for inferior. If there is
Inferior.
any acronym, try to see this box, okay, to understand what is the meaning of that acronym. Understood? First point. ASC, DESC, LAT, EXT, like that. Now, first point. Now, when you are reading the code description 36215 says, what is the family? Thoracic portion. What is that portion? Thoracic portion or brachiocephalic portion. For first order, what is the code? 36215. Yes or no? When you just put one finger at the code descriptions in the page number 36215 and you can put one finger at families. Parallel, you can see the book, textbook. Understood what I am saying? Hold the pages, see 36215 and compare to the vascular family table. If you recall 36215, what is the definition says?
Order thoracic or brachiocephalic branch.
Innominate first order. Now you can see. For first order, what is the code? You just write down there in the top 36215. For first order, what is the code? 36215. Understood? For second order, 36216. For third order, 36217. Understood what I am saying? Just write down the codes in the vascular family. First order, 36215. See, write down like this. See my screen. 36215. Are you following, everyone? Understood?
Yes, sir.
Okay. Second order, 36216. Third order, 36217. Very easy concept. Try to focus for 5 minutes. We will complete the syllabus. Beyond the third order, 36218. See, one question we are getting. That's why I am telling. Please concentrate. 36218. We are getting a question from case study. That's what I am telling. Okay. Anyway, 1 mark only, but try to concentrate. 36218. Now, is that clear now, everyone? First order, second order, third order. Understood? Now, come to page number 918. Page number 918. 918. It's a continuation of that one. Can you see there is a dotted line with diaphragm? Dotted line with diaphragm. Can you see that one? In page number 918. Yes or no? That means what? Above diaphragm, as we know when we are discussing the cavities of a human body, diaphragm is the one which separates thoracic portion to the abdominal portion. Yes or no?
Yes, sir.
Okay. Now if you see abdominal aorta is there. Abdominal aorta.
Yeah.
Okay. Now read the code description 36245. Read the code description 36245. 36245. Read the code description.
Selective catheter placement, arterial system, each first order abdominal, pelvic or lower extremity
pelvic or lower extremity artery branch within a vascular family. Yes or no? Now, for first order here 36245. What is the code for first order? 36245. Understood what I am saying? From abdominal onwards, what is the code? 36245. For second order, 36246. For third order, 36247. Just write down like this. For add-on beyond the third order, 36248. Understood up to here? Three six two four five 246 247 248. Is that clear?
Yes, sir.
Okay. Now you can see. Then after abdominal, common iliac, we need to use the code series. Why? Because these are all comes under lower extremities. Up to that is clear for you? Yes or no? Up to here is the clear?
Yes, sir.
Okay, again,
Yes, sir.
come to venous family. Again, the same code series innominate. First order, second order, third order, 36215. Okay, venous family we will discuss one more day. Don't get confused here. Okay, we will complete up to arterial family. Venous family is only 1 or 2 pages. Understood what I am saying? Leave it, venous family. We will focus only for today on when we are discussing the mock paper. One day I will discuss. So that means you can say Sunday I will discuss regarding that small point, venous family. Try to focus for today for arterial family. Now you can see here. Come to thoracic aorta. If a catheter is placed in innominate and that is the termination point. That means where is the catheter? Where is the catheter in innominate? Innominate means what is the order? First order. What is the code? 36215. If the catheter placed in innominate and moves to right common carotid, where is the end tip of the catheter now? From innominate, it moves to right common carotid. Where is the end tip of the catheter? Where is the end tip of the catheter?
Right common carotid.
That means what is the order?
Second order.
Then what
Second order.
you need to code only 36216. Only we need to code for the end tip of the catheter. For example, if a catheter placed in innominate, they will give you these names. The catheter placed in innominate, move to right common carotid. From right common carotid, it moves to right internal carotid. Where is right internal carotid?
Third order.
In third order.
For third order,
36217.
217. Now, listen the scenario. If a catheter placed in innominate, move to right common carotid, move to right internal carotid, move to right, you can say right ophthalmic. Now, where is the end tip of the catheter?
Beyond the third order.
Beyond the third order. That means what is the code? 36218. But listen here, add-on code we will never use as a primary code. Here the rule says use third order and beyond the third order. That means 36217 218. First point. Where is the end tip of the catheter? First order, code from first order only. If the end tip of the catheter is in second order, code from second order only. If the end tip of the catheter reaches to third order, code only from third order. If the end tip of the catheter crossed beyond the third order, at that time code third order and beyond third order. Understood the rule? Understood the rule, everyone?
Yes, sir.
Okay, now write down these points. Same for all 245, 246. Just you need to identify the artery or vein. In a basic way, I am telling. First one, write down. End tip of the catheter. End tip of the catheter. If it is in first order, second point. If it is in second order, third point. If it is in third order, if it is in first order, 36215. If it is in second order, 36216. If it is in third order, 36217. Last point. If it is beyond the third order, C 36217 218.
218.
Code from 36217 218. Code from 36217 218. Now I will ask a question. Who will answer? Susmita, can you answer? The catheter.
Yes, sir.
The catheter is in, you can say, iliolumbar. You can see the common iliac portion, common iliac first order. The catheter is iliolumbar. What are the codes? Iliolumbar. The catheter is in iliolumbar. Where it is? It is in first order, second order, third order, or beyond the third order? I said the family is iliac. Iliolumbar. Yes, Smita. Are you at common iliac?
Yes, sir.
Okay.
Beyond the third order,
Beyond the third order.
36247, 36247 and 36248.
Great. 36247 and 36248. Understood, everyone? Just here I changed the codes. Why? Because this is a different family. Abdominal, lower extremity family. Above one is thoracic, abdominal, thoracic family. You can see from abdominal aorta onwards, the code series may change. The basic introduction I have given for you. Understood, everyone? First family, second family, sorry, first order, second order, third order, beyond the third order. Just you need to identify the names. Okay. Can you see question number 20? This one big question. Just have a look, everyone, the codes before going to give you the question. Arterial family. Can you see question number 31? 31. Can you see question number 31? Are you there, everyone? Question number 31.
Yes, sir.
There are two codes for you. One is 36245 Yes, sir. ABCD. 245 is there.
Yes, sir.
That means first we need to find out it's a first order or second order. Yes, sir. When you are seeing 245 it's a first order or second order. Now you can see cardiologist advances a catheter into the left renal artery via right common femoral puncture. It is selectively. From where it is moving? From right common femoral to left renal. Catheterization and angiographic films are taken. The catheter was then removed and a diagnostic guiding type RDC catheter was used and the left renal artery was selectively engaged. Then they are doing some procedure at the renal artery. Okay. Now you can see the code description 3624526. Just you can focus in these two lines. In renal, can you see renal where it is? In the first order itself. Can you see renal in the first order itself?
Yes, sir. Yes, sir.
See, if you see renal from common femoral to reach to renal only. Renal it is in the first order itself. You cannot find in the second order. Now first order, what is the code?
36245.
36245 in the options A, B, C. Understood? Is that clear?
Yes, sir.
Now see the remaining options. Why? Because they performed a stent. Read the code description 37236. Read the code description 37236. See, when you are practicing, you will get doubts. Every Sunday I am going to take doubts discussion session. Don't worry, you will clear your doubts. Okay. 37236.
Transcatheter placement of an intravascular stent for occlusive disease, cervical carotid, extracranial vertebral or intrathoracic carotid, intracranial or coronary, open or percutaneous, including radiological supervision and interpretation and including all angioplasty within the same vessel when performed initial artery.
Okay. Then you can see the code description. Or you can see the question. Is that the procedure performed? 37236.
Yes.
37236 is the procedure performed. You can see. Except for lower extremity for occlusive, cervical, carotid, intrathoracic, open or percutaneous. If it is not performed, then you can see 36251. What you will do is just analyze the families for today. Okay. On Sunday's paper discussion, I will explain through the questions, but mark the questions, practice these questions along with that one. Mark the questions. 31. See question number 31. 1 second. I will give you the questions regarding vascular families. 31, 51, 31, 51, 50, 50. Mark, take the questions. 31, 51, 50, 46, 46, 46, 42, 42, 42, 42, 31 already I said, right? 42, 20, 20. Total how many questions? Total how many questions?
6.
6 questions. One more question you can take. 14. Total 7 questions. These questions are from all vascular families, CABC and pacemaker. Try to do at home Sunday 8 to 9:30. Now listen everyone. Just try to focus for 5 more minutes. Sunday, every Sunday 8 to 9:30 is the paper discussion for your batch. Try to do as many as papers, okay? But the admin person will give you the first mark. Try to complete that first mark. We will discuss the mark. And along with, when you are practicing any paper, if you are having doubt, please mark the question number. Then when the doubts discussion session is there, individually you can ask me. At that time, no need to search for your doubts. Understood? First point. Second point, vascular families related questions, and 3 to 4 we will practice on Sunday. First complete this one. Only vascular families. I'm not going to get confuse you. Just 20 minutes I will take again for vascular families, the class on Sunday. Understood? The rest of that you can start preparing yourself. I hope so. Everyone understood the sessions of the total course. Please go through the videos. And again, I am providing backup support for your batch every Sunday, 8 to 9:30.
Mohan, the time can be changed, no? 7 to 9, 7 to 8, 8:30 like that.
I am getting only Sunday week off. At least I can sleep up to 8. Okay, it's okay.
And
8 to 9,
Mohan,
sir, it's fine. 8 to 9.
8 to 9, it's okay. That means Anupama. At least one day Sunday I can sleep up to 7:30.
Yeah,
Sunday
actually,
I
this Sunday, children sir will be wake up early in the morning only.
Yes.
On Sunday. If there is no school, they will wake up early in the morning. If the school is there, they will sleep at 9 o'clock.
You can join, you can ask me initially your doubts and you can get cleared, Anupama. Before 8:30 you can leave.
when I go to class by 9:30, that's why 9:30 I'm already out.
8 to 8. If you are having the persons who are having any issues, initially you can ask me your doubts. You can get clarified from me and you can clear. You can leave the session if you are not having further.
That's fine.
Okay, that I can. But Sunday, please, at 9:30.
Yeah, okay. Mohan, can you describe about concurrent care?
Which one? Concurrent care. See the persons who want to leave, you can exit. Okay. Sunday you are having doubts discussion session from 8 to 9:30. Please practice the papers and you can attend on every Sunday. Okay. Yeah. Concurrent care. Yes, Anupama. Concurrent care. This is the terminology you usually get at hydration and infusions. Hydration and infusions. Okay. Parallelly, they are giving another procedure. Parallelly. Understood? Concurrent means parallelly.
Okay.
Where you got this context? Where you got this word?
I mean, these questions were asked in interview 2-3 times. It happened.
What is that question?
What is concurrent care?
Concurrent.
Where is it used like that?
Okay. Go with the code description. You need to search, Anupama. Have you searched? First of all, you can tell me. Concurrent care.
No, it's in the ENM. In the ENM, I had seen that.
They are asking from ENM. What type of interviews are you are attending? E&M or ED?
ENM, ED, then HCC.
These many. Try to
Yeah.
focus at least one or two. Okay. Yes.
Everywhere I am failed. It's on page 8.
You can page number?
8. Page number 8. Initial.
Page number. Different physicians is providing service, concurrent care on the same day for the patient with different problems. Can you read the quotes? Is there any quotes there?
No, codes are not given. There's just one paragraph.
E&M, right?
8. Page number 8.
Sir, can I ask one doubt and I will leave, sir? I'm waiting for you.
Yes, please.
In respiratory system,
Okay.
submucous resection inferior terminate is doing, and along with the septoplasty also going. So
Both.
here we have to code only submucosal resection terminate, or we can code both.
Both you need to code.
Septoplasty also.
Both we need to code. Okay.
Okay, thank you. There is a note is there in septoplasty. For submucosal resection of terminates, use 30140.
Yes.
So we can use 30520 and 30140.
Yes. Okay.
Okay, thank you.
Yes.
Thank you.
Clearly they documented similar services provided by physicians on the same day for a same patient. That is concurrent care. What is your doubt here, Anupama? First 3 lines. See, 2 physicians are there. 2 physicians are providing similar service to a patient in a hospital. That is concurrent care. Same service by different physicians to a patient. Transfer of care means one physician is transferring the patient care to another physician.
That is different from concurrent, no?
Yes, that is different from.
Because you said parallel.
Parallel. Parallel means side by side. Same. Parallel in terms indicates same. Understood now the concept? Patient is same. Physicians are different, but they are providing the same service on the same day.
Okay. Fine.
Any other?
Mohan, okay. See, 2-3 things I had noted and shared to Ashok, like about this while coding ENM, coordination of care, and then time-based coding. It was asked. That's why I was asking, how is it important? Because the ENM table little bit is changed, no, while coding the office visits.
That table only I have shown you on Sunday. This is the table only used for outpatients nowadays. You can see page number. It is on page number 615, 16, 17. That table we are following. It is already in your CPT book.
16, 17.
15, 16, 17 MDM table. 15, 16, 17. That is the MDM table.
Okay.
Just
So it is the same like earlier.
no.
But I want to ask that
Changed.
it is like a history or appropriate exam like that is description is changed.
Earlier, all the inpatient guidelines are mixed. Now they purely differentiated outpatient table to inpatient table. This is purely used for outpatient. Where is here pulmonary embolism? Understood. And the level of risk also they changed here. If you see in the previous table, IV infusions and everything will be there. In physician office, they will never provide IV infusions and everything. That's why, as per the outpatient, they created this table. You just compare those two tables. Where are the changes you can mark and prepare yourself.
Okay. And no, I want to ask like nowadays this code description is changed, no? Like medically appropriate history and exam.
That means the physician needs to document the history, but no need to evaluate the history. Physician needs to document history and examination, but physician no need to evaluate history and documentation. Only MDM we are looking for and time.
Okay. So time-based selection is purely time-based coding means even if these three components are not meeting and time is given, so we can directly code from the time.
You can go by time.
Hana?
Yes.
We can go by time.
Okay.
Okay. Got it. So that means we have to give preference to MDM, not like earlier that history, exam, MDM, all the three components.
Yes.
Not like that.
Okay.
And okay. And 97 guidelines only we are following now, 95. Or 95?
95, not 97. 95.
95.
95. 97 is
bullets.
Point. Yes, each organ in our organ system. Physical examination. 95.
Okay. So that means we have to do with 95 only.
Yes.
Okay.
That's it.
Okay. Fine, thank you.
Okay.
Yeah.
Sunday, any other doubts? You just initially ask me and you can leave. 8 to 9:30. Thanks, everyone.
Hi, sir.
Yeah. We'll do that. Okay. Thanks.